insurance companies want. Insurance companies want to make a profit, which means that they want to take your money when you're healthy and deny your claims when you're sick. When you need them, there's no guarantee they'll be there for you. Now, they do many downright abusive things, which both the House and Senate bills would ban. For example, rescission, canceling your coverage after you get sick, placing a cap on how much they can pay you when you need them, discriminating based on sex. Right now, women with the same backgrounds and the same medical histories are actually forced to pay more, and discriminating based on so-called pre-existing conditions, which are often genetic or beyond our control. Now, we've all heard of pre-existing conditions, but it's kind of horrifying when we realize what can be considered a pre-existing condition. In some areas, acne can be considered a pre-existing condition. In 8 states, domestic violence can be considered a pre-existing condition. The bottom line is that insurance companies have all sorts of excuses to drop us, and they exercise them with alarming regularity. The bills would also give subsidies to low-income individuals and families that would help them afford insurance and move us closer to universal coverage. The bills would expand Medicaid to 150 or 133% of the federal poverty level, meaning the poorest Americans would be covered by the government. The bills would also give subsidies to people making between that and 400% of the federal poverty level, so whereas they previously couldn't afford insurance, now, with the government's help, they can. All told, this would reduce the number of uninsured Americans between 31 and 36 million. This is a huge step forward, and it's something we absolutely must do. Then there's the public option, which I'm sure you've all heard of. It would be a non-profit insurance plan both run and administered by the federal government. People could participate if they wanted to, but they wouldn't have to. I like the public option because it would have only one priority: serving you, not shareholders and not executives. It wouldn't profit by denying you care, and it wouldn't squeeze you for every last dime. Moreover, the public option would inject competition into our insurance system. Right now, by the Justice Department standards, 94% of health markets are, quote, highly concentrated. A public option would force insurers to compete, to lower their prices, and to treat their customers better. And at the end of the day, remember, the public option is just that: an option. No one will force you to participate. Even if the naysayers are right, and it does go horribly wrong, so what? You can always leave and go back to your previous plan. At best, the public option would be a great boon, but at worst, it would do no harm. So how are things going on the political side? As we all know, President Obama has made healthcare reform his top domestic priority, and he's gone to great lengths to get it passed. Congress, too, has been taking action. Recently, the House of Representatives passed a reform bill by a very close 220 to 215 vote. Now, the ball's in the Senate's court. One thing is clear: we're not going to get any help from Republicans, so if we want healthcare reform, we have to get all 60 members of the Democratic caucus to agree. And this is much easier said than done. In particular, 4 senators are being problematic. They are Joe Lieberman, Ben Nelson, Mary Landrieu, and Blanche Lincoln. All of them except for Joe Lieberman hail from conservative areas, which might explain their opposition. But they know that we need their vote, and they know that they have leverage, so they're wringing every last concession that they can out of us. It's unclear where we'll end up when this bargaining process is over, but these are the key players who you need to keep your eye on. Now, what issues are dominating the airwaves and the debate in Washington today? First, there's abortion. Conservatives insist that public subsidies don't be used to cover abortions because they're morally opposed to them. The bill already would make sure that this doesn't happen, but that doesn't seem to satisfy them. They're going for even more restrictive measures than we've had in the status quo. Now, the Stupak Amendment in the House is the manifestation of this. It would, in practice, greatly restrict a woman's right to choose, especially if she's a low-income woman who can't afford abortions out of pocket. So this is as much of a class issue as it is a sex issue. And then, of course, there's the public option. The public option. Conservatives are worried that it would be a government takeover of healthcare, when of course it would be anything but. It would only be an option. However, they seem strangely impervious to facts. And again, it's unclear what the final compromise will be, but these are the issues dominating the debate today. So what can you do to get involved, to help push healthcare reform over the finish line, and make it become law after over half a century of struggle? Well, first, you can call your legislators. Let them know how you feel so they can represent your views in Congress. It's really easy and it takes only 30 seconds. But if that makes you uncomfortable, write them an email or send them a letter. Either way, let them know that you care about healthcare reform and that you're watching how they vote and you will hold them accountable in the next election. And if you really want to get involved, go to barackobama.com and volunteer with Organizing for America. They've essentially led the grassroots charge for healthcare reform. They're the ones who've been knocking on doors, making phone calls, organizing others, staging rallies, and the list goes on. But either way, call your legislators or volunteer your time. It's absolutely important we get healthcare reform now. Progressives have been pushing for it since the days of President Truman, but this is the first time that we've had a genuine chance. The policy is good. The millions of Americans will be covered. For the first time, we have a political window of opportunity. At the end of the day, it's important that we get involved and that we get healthcare reform by the end of the year.